This video will prepare vaccinators to provide a safe vaccination experience, focusing on comfort for pediatric patients. All vaccinators should feel prepared to support patients with comfort measures to decrease sensations during the injection and help with anxiety. These include the buzzy, which can be described as something that vibrates so you do not feel the poke as much. Cold spray, which can be described as a cold spray that feels like an ice cube to help numb your skin. Other strategies to encourage are using distractions such as toys, phones, iPads, or music in order to give the brain something else to focus on. Keeping the arm or leg limp like a noodle can help us feel the poke less, and taking deep breaths, which can help us feel calmer and less afraid. Now we will review positioning to help for comfort and safety with various age groups. The goal of these positions is to provide security and comfort. Research shows that children who are held down forcefully during painful procedures report feeling ashamed, humiliated, and powerless, as though they had lost control of their own bodies. If these positioning tips do not work to safely provide a vaccine, children and their families should be referred to their primary care medical home to further problem solve. IM vaccinations for infants and toddlers up to 2 years old should be administered in the anterolateral thigh. Patients can be placed laying down on an exam table with their parents snuggling their arms and making eye contact, while the administrator helps hold the legs still. Upright positioning is recommended for preschool and school-age children and may be used for administration of vaccine to the anterolateral thigh or the deltoid muscle. Older infants and toddlers may also experience less distress in a more upright position. The location for the injection should be based on the child's age, size, and preference. Children can be held in a parent's lap facing to the side or facing in towards their parent. The vaccinator should apply stabilizing pressure to the leg if it will be the site for vaccination. To position the child facing outward in a chest-to-back position for arm exposure, hold their child in their lap facing outward. If needed, anchor the child's feet firmly between their thighs. Older children who are bigger or more independent may want to sit on their own. Have their parents sit next to them on the opposite side from where the vaccine will be administered. Ask the parent to sit as close to their child as possible. It is really important to communicate in ways that help acknowledge a child's distress while expressing calm and confidence. When a child says, "I'm scared, I don't want a shot," you can respond by saying, "It's normal to feel scared and not want shots. Getting shots helps our body to stay healthy. Your job is to hold your body still. Taking some deep breaths can help when you feel less scared. When it's all done, you can pick a price." It is important to tell the truth. You can respond, "It will feel like a poke and be over very fast. It probably will hurt less and for less time than a paper cut or scraping your knee. We can use cold spray and a toy that buzzes to help you feel the poke less." Offering a child choices such as which arm to use, how they will sit, and whether you will count down or not can also help them feel more in control.